Hi, everybody. Thank you all for being here. The final leg of our three-part mini-series with SVH Fertility. Tonight we have Florence and Maxie Cohen speaking about their journey with primary infertility, and also being moderated by Dr. Robbie Setton, who is to my left. So excited that we are doing this again. We could never have anticipated the tremendous success of the past two lives. So thank you so much to the families that were involved. Your enthusiasm and support, I mean, the whole community has really just come out and said thank you, and we appreciate their appreciation. It really means that we're on the right path here. And I also want to thank Florence and Maxie in advance, because this is not an easy thing to do, and mabruk to them because they just had a baby. So this is, wow. I mean, wow. Really impressive. And also I would like to thank the Setton family, Dr. Robbie Setton and his wife, Marielle, who have been integral to the success of this program since day one. Actually, Marielle just shared her personal story on our fertility newsletter. Dr. Setton spoke last summer at our launch, which we're going to talk about, I think. So I just want to say thank you in advance. We do have a postpartum support group starting on Monday night. So if anybody's interested, you could DM our account or call the number on the screen. And we do have a fertility and loss support group starting in a few weeks. So that will be very relevant to what we're speaking about tonight. Just to touch on the topic a bit, I think infertility in general, it comes with a lot of difficulties. There's an unspoken pressure, unspoken expectations around family building, especially in our community. A lot of that comes from within, not necessarily from our families and friends per se. We are expected to do a certain thing, and we like to, be successful. And I think in a way you don't really get it until you're in it. You don't know how much you want to be a mother or a father until you start trying. And you don't understand the length of a day, a week, a month until you start trying and waiting and going through the motions. We recognize at SBH this tremendous need in this arena, and we've responded by creating a program that really caters to our community, our needs. We're here to help you through the maze, the confusion. What do I need? Who do I call? Call us. We'll take care of you. We're going to hold your hand. And you'll never, ever feel alone again. Just want to turn it over to Dr. Robbie Setton now. He'll introduce himself. And looking forward to another great night.
Nice. Thanks, Rachel.
Thank you very much, Rachel. Thank you, everyone, for tuning in. And particularly thank you also to SBH and all the effort that the committee and that people have put into this initiative over the last year. It's really been tremendously successful. It's helped a lot of people. So as mentioned, I'm Dr. Robbie Setton, my fertility specialist. I actually just recently left Cornell after completing my fellowships and my subspecialty training there. And after the summer, I'll be joining Shady Grove Fertility in Manhattan, and then a couple of months later, we'll be expanding, opening up an office in Brooklyn, which we're very excited about. Be able to increase our access and our reach, and be able to be more accessible to the community members, and help people provide all different types of fertility services. Just wanted to share very briefly kind of my story and a little bit of my background, that's kind of what brought me here. So when I was towards the end of medical school, my wife and I were trying to start our family, and it ended up being a lot harder than we had anticipated. And after about a year of trying, we went for an evaluation, found out that my wife had diminished ovarian reserve, went through a couple of cycles of IVF, all of which failed. We're told by two different doctors to proceed with donor egg, but we weren't ready for that at the time, and so we kept trying. And then after 6 cycles of IVF, finally got pregnant with my son. And when I saw the heartbeat, I always kind of tell this, when I saw the heartbeat, after all those years of trying, I kind of pivoted my career, and I knew that was kind of my moment where I knew I wanted to become a fertility specialist after being a fertility patient for such a long time, and to be able to provide, kind of relive that moment, and to be able to give that to other people. We did another 7 IVF cycles for my twins that I had about 2.5 years ago, and had a miracle, and my wife is now pregnant with our 4th without any IVF, which is really beyond anything that I could have imagined. So that's sort of my piece of this, and where I'm coming from, and why I do what I do, and why I want and why I'm so supportive of this initiative that we have through SBH. But I'm going to turn now to the real star of tonight, which is Florence Cohen, and I really do mean that, because it takes an incredible amount of courage to kind of lay yourself out before everybody, and to kind of tell your story. That's a very personal story. And without further ado, I'll give it to you, Florence. Especially being that you're 1 week postpartum, or 2 weeks postpartum now, which is even more incredible to me that you're here with us today. So thank you.
Thank you. Wow, amazing. Thank you, Robbie and Rachel. Crazy stories. Really, childbirth is a miracle, and for it to be your occupation, that must be so fulfilling. So that's amazing. Yes, I'm so nervous about this, but we'll get through it, right? Okay, so growing up, I was always like a tomboy and a very big athlete, loved sports, a skateboarder with the backwards hat on, So I don't know, I feel like that leads to my story, because when I got married 2 summers ago, right? 2 summers ago. And I actually I started my cycle later than all my friends. Maybe I was 16, 17, maybe late junior, early senior year. And it was never a regular cycle. But I was kind of like naive about it, or like okay with it at the time. I went to a doctor when I was single just to make sure everything was okay, and they said, okay, you're irregular, but your hormones are good, your thyroid's good. You could go on birth control if you want. I know that's out there. But we decided, my mom and I, that I didn't need to, and we just left it as an irregular cycle. Then I got married, and I went on birth control, not realizing that it wasn't working, but I went on it, and also it didn't regulate me. I was still irregular, but I guess I was just enjoying the benefits of it instead of thinking, okay, this is a problem. So a year after marriage, Rachel spoke about like unspoken rules or codes or whatever, but it's kind of like, okay, you're married for a year and it's time to start your family now, and so that's what I did. And I went off of the pill, not really asking my husband, but more like saying, okay, like the year's over, like time to start a family. And he just said like, okay, like let's do it, I guess. And a few months in, like I was just at a plateau where I wasn't getting, I wasn't getting it, and I also wasn't getting pregnant. So I didn't know what to do. So I Googled, and I started with Ovulation Kits, which was not helpful at all, but You basically just like monitor. I'm sure you can understand that or explain it. But yeah, you basically monitor when it's like a good time for you to try, right?
Basically, yeah. So with ovulation kits, it helps you detect when you're ovulating, and that way you can time intercourse appropriately in order to try to maximize your chances of getting pregnant.
Right. So I was doing that, and it can get crazy because like every second I would try after I eat before bed. Also was doing a thermometer because apparently I also Googled, or Google told me that your fever spikes a little when you're ovulating.
So
I was also doing that.
Yeah. After you ovulate, when your progesterone goes up, it makes your temperature go up by about 1 degree. So if you take your temperature every day, then that could help. Let's assume but
right. It's a little crazy, but that's what I was doing, and it wasn't working. So I decided to go to a regular OB, a gynecologist, just to make sure everything's okay. Even though I already went when I was single, I guess I just wanted another opinion. So I went to a girl, and she did the same thing, took the same test, said, "You're fine." I was like, "I'm not fine. Stop telling me I'm fine." And she's like, "Okay, well, I can't do anything for you. This is like as far as my education goes. But here, go to, if you want to like try more, go to RMA, infertility specialists." And, that was very hard to hear. And also, she didn't really take me so seriously because I was a 23-year-old girl, trying to have a baby. And she's just like, "All right, take your time. Like, it's fine." Like, but I'm like, no, I need it. Like, something's wrong. I need help. She wasn't so sensitive to that, which was hard. So then when she gave me the card, that's when like I realized, okay, I think I have a problem. But I took the necessary steps to, try and fix it. So I guess I was occupied with, all right, what do I have to do next? And then I called RMA, and they didn't give me an appointment for another few weeks. And I secretly hoped that I would get pregnant by then and I wouldn't have to go, but didn't happen. And I went. And so I went to RMA. They're amazing. We had a consultation, my husband and I, and the doctor, Dr. Lucky Setton, she's amazing. She diagnosed me with PCOS right off minutes. It was like, okay, you have PCOS. If you could explain that, because I know it's like an umbrella term.
Yeah. Well, I just had one other question for you, actually. During that whole time, with seeing your OB and then waiting to go see the specialist, were you getting periods at all during that time?
Not really. Like, very light, every like 3 months.
Okay. So one of the things that I think is important to recognize here is that, when should you go for an evaluation? And you kind of were feeling it. You were saying that you felt that something was wrong with you, and you knew something was wrong, and so you sought out help, which was the appropriate thing to do. Not getting a period, if you're beyond 5 weeks without getting periods, that's an abnormal amount of time, and it likely indicates that you're not ovulating, and you need to ovulate in order to conceive. And so it was very good that you ended up kind of seeking out help. Where PCOS, that's something that a lot of people I think have some misconceptions about and misunderstandings about. Some people are labeled with that without actually knowing why or how. So in order to be diagnosed with PCOS, you have to traditionally meet one of 2 of 3 criteria. You have to have irregular cycles, which is cycles that last more than 35 days or 5 weeks apart. Have polycystic appearing ovaries on an ultrasound. So an ultrasound is done where they look at your ovaries, and it has kind of a characteristic appearance, and that's done by an OBGYN, a radiologist, or by a fertility specialist. And then the last part is what's called hyperandrogenism, which is basically higher levels of male hormones that are in the body that are either detected clinically or with blood work. What's important also is that PCOS is a diagnosis of exclusion in a way, in that you have to also do some other blood work to make sure that there's nothing else going on that's causing the irregular cycles. So you can't just talk to somebody and say you have PCOS. You have to actually do an evaluation. You have to have blood work that's done, which it sounds like was done in your case.
Yeah, it was done right after she did all those tests. But it's important, the third thing that you said, more male hormone. For me, like when she said that, for some reason I was like so set on it. I'm like, oh my gosh, I was a tomboy all my life. I was the best athlete all my life. And like everything I loved like is now like, you know, hurting me. So it was definitely like a lot, you know, to take in. But I also did have polycystic ovaries or polycysts.
Yeah, you got it.
She checked my ovaries, and there was like million little bumps.
Yeah.
And it wasn't like nice mature eggs that it should be. It was just like little bumps. So maybe that's also why she diagnosed me right away. I don't remember exactly what we did that appointment. But anyway, so she gave me the pill to help me like get my period. Lexadrol, I think, or that was the trigger shot. Lexadrol. So she gave me that, and I took it for, I think, 5 or 7 days, and then I waited a few days, and then I would go in, and she would check my ovaries to make sure they're not polycystic, and there's actually mature eggs in there, for her to then give me an injection to trigger it to fall, right? To fall out.
Trigger ovulation, yeah.
Yeah, for the mature egg. So, but that was also done through a transvaginal sonogram, which was, you know, not comfortable at all. And during that time, and I also we also had to rule out other things, like you said. So I had to check my tubes, my fallopian tubes, to make sure that they were open. And that was really scary because like they're the size of a pin. So it's like, right, they're teeny. Yeah. So it's really scary to think like, what if they're closed? I don't know what that means, but thank God it wasn't the case. So we ruled that out. But that whole MRI was really uncomfortable also. And then we checked his fertility to make sure that, you know, he's fertile, which was really uncomfortable for both of us at the time. And I think just blood work after that. And I was also, at this time, I was volunteering at NYU at the pediatrics floor. I was like playing with the kids, the sick kids. I was more like just like watching them and cleaning toys, and that was helpful for me because it kind of like got out that itch of wanting a baby. Like I was taking care of other kids, which was nice. And I was also in college part-time learning about the brain, so it's so cool like going through this and like really knowing what it means like through education. And I was also doing grandma's cheese, which I'm on. I should be. Oh, I'm with Flo J. Cohen. Oh, I'm sorry. I wanted to be on the Grandma's Cheese Instagram because I was definitely using my business to distract me during this time, because we ended up doing the pills and the waiting and the sonogram and the trigger shot for like 5 or 6 times before, you know, it worked. But anyway, so we did it 3 times now in the storyline, and after 3 times my doctor told me like maybe it's time to be a little more aggressive, and so we did IUI the 4th time, also totally my decision. At this point, it's still all my show. Like Maxie's just sitting and listening and saying, whatever you want to do, I'm with you. You want to do this, you want to do that, no problem. So once we did the IUI, that was really a whole thing in itself.
Do you want to explain what a IUI is?
You can explain what an IUI is.
Sure. So IUI stands for intrauterine insemination. Basically, what's done is the partner, the husband, provides a sample that gets washed in the lab and then spun down in order to kind of have like a more purified sample. And then it's put into a catheter. And the patient, the female partner, goes just to an exam room, has a speculum exam, kind of similar to getting a pap smear. And the catheter with the sample is then just kind of bypasses the cervix and goes directly into the uterus. So it's pretty quick, but you can kind of maybe comment on your experience with it if it was, was it painful or uncomfortable?
It wasn't hard, or it was very quick, and like considering all that I was doing, I guess it was minimal, but it was just weird to think that this is how I'm going to start my family, and like in a doctor's room, like with like the gown on a table, it was just not what I expected at all. So emotionally it was very hard, but physically I didn't think it was so crazy. But after that, which didn't work, that was like my breaking point. That's when I'm like, okay, I need to take a step back. This is all just too much. And that's when I went to Maxie and I said, like, this is a lot. I think I'm done here. I think maybe I'll take a break, come back to this later, doing that and it not, I don't know, that was just like my point. And that's when he said, I don't know if you want me to speak for you, but he said that's when he started pulling the weight. He's like, no, I think we should do it. Let's do it together. He mentally got into it when he realized I wasn't. But he definitely pulled me up there. But it's hard because like you go to parties like as a woman, and this is when you're going through this, it's all you think about every minute of every day, doing everything. You're home, you build it for your family, your dinners, like you're building recipes for your kids, like everything has that in mind. And so for me it was very hard emotionally going out, seeing pregnant people. It was hard for me because I wanted it so badly, and my emotions were saying, we're almost resenting them. And my logical side of me was like, why would you resent them? That's terrible, But it's just one of my mentors told me this, that it just means you want it so badly, and it's not something that you should judge yourself for, but it's a real emotions and, your head coming together. Also, when you do get your period, I feel like it should be mentioned. It's like a mourning of the life you could have had, So it's physically painful, but like you're actually mourning that, like that possibility, that potential, like it's just gone. So that's really hard. And I don't think a man could really understand that. And that was the first time in my marriage where I would tell him something and like he would listen, but he can't. Like, I'm a woman, I was built for this, we're all built for this, biologically and emotionally. Like this is what we were created to do. And now I want it so badly and it's not working for me. My body's like failing me. That's all I would tell myself every day. Why is my body failing me? So when I hit that point and when he said, okay, let's try again, that's when I like pivoted and changed my perspective and said, you know what, I'm healthy. There are a million things in my body that is working. you know, I can't focus on the stuff that's not working. So I did yoga like almost every morning, which was amazing. I did yoga of the people. I went vegan because I was also taking a nutrition class, and they convinced me that veganism is the way to go. So I did that. And I also did acupuncture, just to try to like relieve some stress that I was feeling, you know, with my body, and like the hate that was in the air. I was trying to minimize that. And then, so the next round we did regular timed intercourse, which was, so we took a step back. I said, I can't do the insemination again. It's not for me. And I can't be okay with like it not working out. Like I was scared to see what would happen there again. So, we did the regular, pills and the trigger shot, and thank God that worked, which is amazing. And yeah, now we have a beautiful baby girl.
Congratulations. That's really, I have to say, it's what a incredible story. And, you know, I think that what you're talking about in terms of, particularly when you were speaking really, you know, beautifully and openly about how you felt during that process, especially when you would go out. I think that's something that probably speaks to a lot of the people that are listening right now. And so thank you for sharing that. Was there anything that you felt at the time that people said or, you know, that was helpful to you, or things that you thought were maybe on the flip side very hurtful to you at those times?
Yeah, definitely. When my mentor told me, like, you're not resenting them, you're not a bad person for feeling this way, that was huge for me. You know, to know that it was just something that I really want, and I'm not thinking negatively towards anyone. Things that were hurtful, I think in general, people don't know this side of life, so they don't realize. But thank God, like my family, both sides, like they weren't so, I didn't get any like direct comments. But yeah, I want to be more helpful.
There's definitely an insensitivity towards trying to have a baby. You know, like you could be talking about something on the Friday night dinner table, and the person next door, across from you, just had a miscarriage or something. Like that stuff goes on every day, and I just don't think people realize that it's, you know, you literally don't know what that other person is going through right now. So I think you have to be careful about even the light chatter of like, who's having a baby next? You'll joke around, you should have a baby. I want to, you know, like people will just kind of talk about it because it's a beautiful thing to talk about, but I think it could get a little dicey.
Yeah.
Right. Absolutely. Maxie, since I have your attention, okay if I put you on the spot for a quick question? I just you know, as the, you know, the husband in this situation, as the partner in this situation, well, one, if you care to share, if you want to, you know, kind of what your kind of side of this was and how you felt towards it. And also if you have any message for any of the husbands that might be listening now, that maybe are in the position that you guys were in, you know, a little over a year ago.
Yeah, I think initially it was hard because I wasn't committed to the concept of having a kid yet. So she was really battling it on her own, which was rough, because for the first 6 months she was really doing it herself. And even though I was supportive, I wasn't carrying any weight, and that hit its breaking point at a certain time. That was pretty stressful on the relationship. But once I was I just think it's hard to be in and out of the doctors, you know, it's just hard. It's just, you know, you're building that into your schedule, into your routine, and you're in and out of the doctor's office a couple times a month, and you know, it's definitely a draining process thing to be doing. And obviously, like, maybe I couldn't understand the morning, but your partner is out of commission for a couple of days in morning, and that's hard to see too. So I just think, I mean, the reality is the women are amazing what they do and what they deal with, and on a daily basis, on a monthly basis, you know, and you know, but I think it's an emotional journey for the couple. Taking tests to see if you're fertile, like that's not a fun.
Right.
You know. And
no, absolutely.
Also, it's like you're very timed, so you gotta like.
I'm talking.
You know,
you talk
like,
louder.
Yeah, sure. Everything is very timed, so you have to. If your head's not in the game and you don't come home early that night to have dinner, to relax, to be in state together, you know, you end up like you're rushing it, and it's like it's like a thing on the checklist, and it's like that's not really the way it's supposed to be, I don't think. You know, so it's like it's a journey. It's definitely a journey.
Yeah, I mean, you know, you bring up a lot of good points as well. You know, I think what a lot of people don't realize is that it ends up, and Flo, you can probably comment to this, it ends up kind of becoming almost like a full-time job in a way. You know, you're going in for monitoring to the doctor's office frequently, you're getting blood work, you're having vaginal ultrasounds, you know, in some cases on a daily basis even. And kind of your whole world revolves around it, and you do trigger shots and everything has to be timed, and you're right in that it really kind of consumes everything that you're doing and everything that you're thinking about at all times of the day. And, you know, as you said, people don't necessarily understand that. And I think, you know, one thing I want to kind of point out is just how common this is. You know, 15% of people will suffer from infertility, you know, and that's a real number. It really, really is. And you had mentioned miscarriages as well, and that's something that, you know, the SBH also kind of talks about. And, you know, happen 25%, 30% of the time also. These are incredibly, you know, common things and very real things that we have to, that are part of all our lives. And so I think it's very good that we sort of are trying to build this network within our community to help other people that are struggling with it. And kind of in a similar vein, I guess, one thing I think would be nice just kind of for me to give just like a small teaching point just to kind of for people to understand, because I think I'm seeing in some of the comments people wanting to kind of know when to be evaluated and things like that. So technically, a fertility diagnosis is given after 1 year of trying, with regular intercourse, if you're below the age of 35. If you're above the age of 35, after 6 months of trying, if you haven't gotten pregnant, then you should be evaluated. That being said, if there are some things that are known risk factors or some known conditions, you don't need to wait. You don't need to try for a month. If you don't get a period, that means you're not ovulating, you can't get pregnant, so you don't need to wait a full year. You just go in right away and get evaluated. If you know that you have stage 3 or 4 endometriosis, that's another reason to go in for help sooner rather than later, and as well as some other things. And in terms of how quickly should people expect to get pregnant, I think people don't really know, because I think people get very frustrated if they try in their first month they're not pregnant. The chances of getting pregnant with each cycle is about 20%. With one cycle, about 50%, so about half of couples will get pregnant by about 6 months, and then 85% by a year, and that's where you leave that other 15%. So that's also just kind of to normalize things. And another thing that kind of comes up from the story is when you should see your OBGYN. You know, sooner rather than later, I would say is the choice. And when should you kind of escalate to a fertility specialist? Well, you can always start with your OBGYN, and they can start a basic evaluation. because there is, you have to check some hormones that to make sure that you're ovulating normally, that the brain is sending the normal signals to the ovary, that the ovary is able to ovulate, that your tubes are open, that your uterus doesn't have anything there that can get in the way of a pregnancy and planting, and then also the semen analysis. And if you're trying to see a fertility specialist, there may be a 1 month to 3 month wait to see the person that you want to see. And so seeing your OBGYN can at least get the ball rolling for you in the meantime while you're waiting. And I think those are important things to know. So I want to kind of try to maybe address some of the comments or questions. So can you also address how fertility issues are more common now than they were in the past? So it's a good question. The truth is that the diagnosis of it has changed and the treatment of it has changed over the last several decades. And so while people had fertility, the actual incidence of infertility in the general population is the same. It's just that we're recognizing it, and there's something that you can do about it. And back in the day when nothing could be done about it, then it wasn't really officially diagnosed in certain cases, and so it just wasn't counted. So the prevalence is actually the same.
Cool.
What else? How do you know what to?
Something I wanted to say, I forgot.
Any questions? You can put it in that little question mark box on the bottom. So someone's saying, how do you know when to go to a fertility doctor? I think we touched on that.
Also, if anyone wants to reach out to me, I don't know if I mentioned it yet, but the panel that you did, Robbie and Rachel, last summer was amazing. It helped me to reach out to people there and people in general. When I saw like what people were going through, and it was similar to my story. It was reaching out to them and just like talking, not listening to solutions or advice, just talking it out to someone that was there, someone that relates to you, was very helpful for me. So just want to mention, if anyone wants to call and talk to me, I'm here to listen.
Thank you very much. It's really, really very kind of you. It looks like we have some more questions. How does PCOS affect athletes? This kind of talks to that, well, being a tomboy. If you're very, so there's kind of two separate things here. If you're very athletic, that can, and have kind of go through excessive exercise, that sometimes can cause you to not ovulate. That is something separate from PCOS, which is a different condition that's present in the ovary that causes you to not ovulate. When you're very athletic or in high stress situations or in high exercise situations, the brain signals kind of just don't talk to the ovary. So the issue is more with the hormones that are coming from the brain, rather than what's going on in the ovary itself, which is the case with PCOS. And even though in PCOS there are higher male hormones, that doesn't actually affect kind of it doesn't kind of make you predisposed to male type of behaviors and things like that. It's not that high that it causes that.
Someone's saying, does PCOS always cause infertility?
So the issue with PCOS, if you don't ovulate, then you can't get pregnant. Ovulation is the process of releasing the egg in order for a sperm to then meet up with it to conceive. People with PCOS most often do not ovulate. However, that doesn't mean that you won't ovulate on occasion, and so you still can get pregnant naturally with PCOS, but it will likely take a lot longer.
Another question is about checking for clotting factors that could affect implantation. Repeat the question.
So let's say there's a question.
can you mention getting checked for clotting disorders, how that affects implantation?
So with clotting disorders, that's more relevant with recurrent miscarriages, and particularly in with second trimester losses or later losses. When you can have something called antiphospholipid syndrome or other thrombophilia or clotting disorders, and that may affect your ability to maintain the pregnancy rather than get pregnant in and of itself. It won't prevent you from getting pregnant, but keeping the pregnancy. And so that's something that can be evaluated, and you can be on anticoagulation, meaning medication that's like a blood thinner during the pregnancy. There's a question for Flo. That was there. There's a question for Flo.
Florence, somebody asked you about prayer and religion and how that played in. Do you want to answer that, or you don't have to?
Yeah, I mean, definitely stronger. It was definitely more spiritual, praying every morning. It was hard. Definitely, you know, I don't know what else to say. I knew that I needed to be proactive and that I couldn't just, you know, pray for it and hope. But I was, you know, all throughout praying that it would, that when I guess whatever was meant to be would be, and that I could get through it, you know, emotionally and physically. That was the biggest thing for me.
And I don't know if there's any, I guess we can't know for sure, but it happens to be that when she became more present and there was less stress in her body and she was doing things that were healthier like yoga and whatnot, we got pregnant during that time. So I don't know if there's any data on that. Right.
Yeah. So actually, being stressed or and kind of having this you know, kind of persistent state of essentially stress in your body can potentially predispose you to not being able to get pregnant. That doesn't mean that you know, I don't want to alarm people and say, oh, if you're stressed, you're not going to get pregnant. That's not what that means at all. However, having a healthier lifestyle is always good. It you know, boosts your cardiovascular system, your heart rate, blood pressure, etc. All these things are important, especially later on in the pregnancy. It's kind of having a well-balanced nutrition is also very important. These are sort of things that kind of go with if your body feels extreme stress. So when I talk about athletes, I mean sort of like very, very intense athletes, to the point where your body is in so much stress that your brain starts to think that it's not a good time to get pregnant. And so the hormones, it kind of shuts down in a way that's the center of the brain that releases the hormones that tells you it's time to ovulate and you know, and have a baby. So that's sort of those times of extreme stress or what happened. You can have that with anorexia, which I saw someone had mentioned as well. You can have that with, again, the kind of being very, very athletic, or in high stress situations, like sort of extremes of stress. And like as an example, it's often spoken about how in the time of the Holocaust, women stopped getting their periods, and that was because they were malnourished and they were in high stress situations. I mean, it doesn't necessarily have to be in that sort of extreme of a case, but just kind of to understand that that's what's going on.
Yeah, I think also that to that point, a lot of people say, oh, you're stressed. That's why you're not getting pregnant. Stop thinking about it, you know? So I think you make a good point. It's like, no, that's not the case. You know,
no, it's extreme stress. Extreme stress.
Okay.
Yeah.
I think that's worth noting. Also, we found out that we were pregnant right when we signed the lease to move to Deal. So I think that's also nice and spiritual. You know, they say when you change, what's it?
Change the location.
Yeah, exactly. That was us. Thank you.
Someone's asking, could you expand a little more on diminished ovarian reserve?
So someone's asking about diminished ovarian reserve. So diminished ovarian reserve. So ovarian reserve kind of refers to your reproductive potential or your ability to get pregnant. That's sort of a function of the number of eggs you have and the quality of eggs that you have. The number one determinant of quality is age. And so the older you get, the lower your ovarian reserve is. But you can also have young people that have diminished ovarian reserve, and that's when sort of the process starts a little early, and so the number of eggs that you have goes down. Another kind of important aspect of it that's kind of the, other side of the same coin is that it predicts that it's a predictor for how you're going to respond to ovarian stimulation. What I mean by that is how you're going to respond when you go to a doctor and they give you hormones to help you try to get pregnant. If you have diminished ovarian reserve, you need more medications to get pregnant, and it's more challenging to get pregnant. And so there's the expectation is that there's a longer time to be able to conceive in that case.
Is there, you want to talk about the symptoms?
With no symptoms actually, which is the part that's kind of scary about it in a way is that you can have regular periods, be completely healthy, and you may have diminished ovarian reserve. It's not a common thing by any mean.
Someone's saying, is there a cure for PCOS, or you just live with it?
It's a good question. There's no cure for PCOS. That being said, it's something that people may actually grow out of in a way. If you have PCOS in your 20s, that may go away in your 30s. So sometimes it just kind of goes away on its own. And the management for PCOS, though, is, if you want to get pregnant, you induce ovulation. But again, you still can't have ovulations occasionally with PCOS. If not, then you want to regulate your periods, and then birth control is the best way to protect yourself, because with PCOS, there are other medical conditions that you want to protect yourself from. You don't want to have these kind of spaced out periods, because that can have other kind of health consequences as well.
I heard that like the cure to infertility is fertility. Is that right? Or like,
sorry, say it again.
Baby. Like the cure to infertility is being fertile or having a baby. Is that?
Well, I guess that solves the problem.
That solves the problem. Right? No, that makes sense.
Well,
so, you know what I'm trying to say.
Right. So one of the counter measures. So for PCOS, some of the health risks that are involved are endometriosis and things like that. So I think what you're talking about is that endometriosis is a good example of that, because endometriosis is a condition that's characterized by pain and infertility. And when you get pregnant, it temporarily cures it, actually, because of the hormone changes that you have. So that might be what you're referring to.
There's a few questions that just came in. How to handle an unexplained infertility diagnosis.
Okay, so with unexplained infertility, so first, just to explain what it is, unexplained infertility is when every test that's done comes back negative. So you check the hormones that are coming from the brain, you check the ovaries, you check the tubes, you check the uterus, and you check the male partner as well, and everything is normal. So that's unexplained infertility. About 25-30% of the time, that's what happens. With unexplained infertility, and you've been trying for a year under age 35 or 6 months over 35. With unexplained infertility, it's very frustrating because there's no kind of cause that we can pinpoint at this time. Maybe in the future there'll be other things that can be other ways to diagnose. But with unexplained infertility, typically you move actually towards more aggressive treatments sooner rather than later, because doing things and that's the fastest way to get pregnant. So going actually, trying for a short amount of time, up to 3 months, and then going straight to IVF after that would be kind of one of the unique things about unexplained infertility.
Someone's saying, can you develop PCOS after having children, or is it usually present
from puberty?
From puberty.
So PCOS, the definitions of it changed a couple of years ago and actually can't be diagnosed, or it shouldn't be diagnosed up until 8 years after the start of your period. So a lot of people, because it's normal in your teenage years to have irregular periods, particularly in the first year, and it can take 3 and sometimes up to 5 years to kind of completely regulate your periods. And so we don't make the diagnosis of PCOS until you're at least 8 years out from your first period that you ever had. And sorry, what was the rest of the question? Was
oh, do you still have PCOS, or could you have PCOS after?
After, yeah. So it depends on when you get pregnant. But you know, if you're getting pregnant early and then later on, but yes, you certainly can. In your 20s or 30s, you can develop PCOS. But though typically I would say it usually would present itself sooner earlier in your reproductive years.
Someone's asking, is there a truth to developing secondary infertility as a result of scar tissue developing after a C-section?
Yes. So a C-section is a surgery, and just like any time that you kind of cut your skin and it forms a scar, there can be a scar that forms inside the uterus itself that can get in the way of a baby growing. And what's kind of reassuring about that, though, is that if that, well, one, it's not a, you know, not a common complication, but it does certainly happen. So if C-section is needed for whatever reason, then it's needed. But it's actually pretty easy to fix with a pretty minor procedure to break down that scar tissue.
We'll take a few more questions. Someone's asking about any other reasons why someone wouldn't ovulate other than PCOS.
Yes. There's many reasons why someone wouldn't ovulate. PCOS is one of the most common ones. And so that's kind of why that gets thrown around. As mentioned, so everything has to work from the brain down to the ovary in order for ovulation to happen. So states of high stress, as we mentioned, can cause someone to not ovulate. There can be other kind of syndromes that some people are born with certain conditions that cause them to not ovulate. But PCOS is probably the main one that to think about.
Okay, I think last but not least, you want to just talk about birth control pills and whether or not that can affect your fertility and how.
So birth control pills won't affect your fertility. If you take them for a very long time, it could suppress your ovaries enough that you may need a little bit of time to bounce back. But that's a pretty short interval of time, up to 3 months max.
Okay.
Someone asked me how my pregnancy was, and thank God it was great, normal. After 10 weeks of being with the fertility specialist, because they needed to make sure all was good, I went to a regular doctor, and thank God I had a good experience, a normal experience.
Okay. I think we're going to wrap up. Thank you. Thank you. I've just been astounded every single week now by the courage of our families and also the professionalism of our moderators. And I just want to thank them sincerely and everybody who tuned in. Really, this was beyond what we could have imagined once again. So we really appreciate it. Just to remind you that we are starting a postpartum support group Monday evening, and we are starting a infertility and loss support group in a couple of weeks. So if anybody's interested in that, please reach out. We are here for you, whatever you may need on your journey. If you're not sure what that is, if you're not sure what help you may need, please don't hesitate to reach out. There's a number on the screen that's pinned. And I also just want to quickly thank Naomi Dweck because she really helped arrange the speakers tonight. So thank you, Naomi. Thank you to our whole committee. And hopefully we'll do this again. Thank you.
Thank you, Rachel. You're amazing.
Thank you, Rachel. Thank you, Glo.
Thanks, Robbie.